something that has changed the way healthcare is being looked at in this country, especially the issue of cancer. And you want to bring this hula baloo in the media, and I've been in select committees. Believe me, media excites us.
In Busia, and after open tender, and the documents are there, Clinix and Meridian were chosen to implement that scheme, and Thika Medical whatever was also chosen in Nairobi, plus a number of public health facilities to roll out that scheme. The sample that was used, according to Alexander Forbes, in a report that Alexander Forbes submitted later, proved to us, NHIF, that actually the sample, contrary to what my friend was saying today, was actually big enough, and the report is here, to make it possible for NHIF to assess accurately, given its membership, and Almas was right, given its membership at that point in time, not all Kenyans, that actually NHIF was capable of rolling out outpatient care under universal coverage. It is on that basis, and the reports are here, it is on that basis that when the Ministry of Public Service approached NHIF, NHIF was actually prepared to roll out an outpatient and inpatient care for the civil service, the police, and the disciplined forces. And Mr. Speaker, when NHIF did that, one thing was very important. What formula were they going to use to serve the 200,000 plus civil servants in rolling out this scheme? They had to use their own service providers. And the service providers for NHIF are both private sector service providers and public sector private providers. Members of Parliament must know that in Kenya today, 50% of healthcare is provided for by private sector, including NGO and mission hospitals, and the public sector. So when NHIF therefore gave a tender out, an open tender for people to apply, given the conditions under the contract with Ministry of Public Service, those who applied had to meet those conditions, and they were chosen on that basis. Again, the documents are there by NHIF to say so. Now, Mr. Speaker, let me just say one thing. Precisely because Meridian and Clinix did the outpatient pilot program, they were much more prepared to respond to this tender than others. They were much more prepared. Secondly, Clinix and Meridian have done in the health sector what Equity Bank did in the banking sector. In other words, Clinix and Meridian realized that if you are going to roll out outpatient care, take your services to the people where they are. Let it be close to the people. The second thing you do, make your consultancy fee accessible to the people. Now, Mr. Speaker, some of the private sector hospitals which didn't do this could not do so, but later they learned the game. And let me give you an example. Karen Hospital, which refused the capitation earlier, learned the game later, and Karen Hospital itself has started putting its clinics in Meru, in Nyeri, in Nakuru, in Naivasha, and in actual fact in Meru, Karen Hospital for consultancy charges only 200 shillings, whereas Aga Khan, which is also a branch there, charges 1,000 shillings, and obviously people will go to Karen Hospital and not Aga Khan, I'm telling you. So it's a question of trade wars. What has happened, Mr. Speaker, in this whole hulabaloo is that we are witnessing a very good trade wars in the health sector. The losers are fighting the winners, and as usual in Kenya, when the losers are fighting the winners, they will go to POA, they go to CASA, they will come to Parliament. Indeed, today, in another tender in government, somebody was showing up as a document of somebody who has gone to POA. Rather than wait until POA has made a decision, they are coming to Parliament to ask for parliamentary to ask a question. So, Mr. Speaker, let us be frank with each other. When we see these trade wars, and we see that these trade wars are alleging irregularities, let us establish competent bodies to look through these irregularities professionally. And indeed, that is what I recommended when I made my speech soon after that halabaloo at NHIF, that I would like forensic experts, I would like CASA, I would have National Audit Office, I would like Efficiency Monitoring Unit, all these four, to go to NHIF and establish the truth. Because these bodies are competent. And if necessary, if you want another private sector forensic firm, let them do so. But Mr. Speaker, we cannot guesswork this kind of thing, because when you guesswork, you make a lot of mistakes. Mr. Speaker, I've gone through this report. This report is full of so many inconsistencies. I would go through those inconsistencies, but there's no time. But I've written them down, and I can give them to any member. First of all, the report started by saying, Mr. Speaker, let me refer to it. The report started by saying that key among matters that the committee sought to investigate and establish, as shown on page 8 of the report, were the following. One, whether the NHIF accredited facilities run by the private health service providers that had requisite infrastructure and capacity to offer the services enlisted under the scheme are very good objective. Two, whether civil servants and members of the district process were accorded the opportunity to make a choice on the facilities from which they could access Medicare, a basic principle capitation model in healthcare provision. And there is evidence that indeed NHIF, working with the Ministry of Public Service, did offer civil service opportunities. And there is it was advertised in the papers. And there is a report that has been done on it. And you cannot deny facts, Mr. Speaker. Thirdly, whether the private health facilities had the appropriate geographical spread, and they did. Fourthly, whether the private health facilities, clinics accredited by NHIF were actually located in the designated areas or were non-existent. Mr. Speaker, this is something that... Okay, go ahead.
Proceed.
May I inform the Minister that the advertisements are actually here and they were provided to the committee, but they chose to ignore. Here is the report. I can table it here, Chair. It was given to the committee.
Mr. Speaker, let me deal with this. Let me deal with this issue of non-existence.
What's the point of order, Honorable Wanda?
Mr. Speaker, once again, I request you protect me from the members. Mr. Speaker, is the member, the Honorable Baisa Karuto, in order to cite an advert whose content is not able to read the House so that the House can hear and understand what that advert reads? Mr. Speaker, would I be in order to ask that the Honorable Baisa Karuto reads the content of the advert he has talked about?
Speaker, the information was for me, and I think I accept the information. Mr. Speaker, the issue of existent and non-existent clinics or facilities. Mr. Speaker, when this issue came out, I ordered the medical practitioners and dentist board, as well as officers in my ministry, to go around the whole country and inspect all these facilities. All the facilities accredited to NHIF and registered by the Medical Practitioner Dentist Board. Mr. Speaker, the report is here. The report is here, and I will table this report. This report shows, Mr. Speaker, that all these facilities were existent. Secondly, Mr. Speaker, when any facility, government or private, is accredited by NHIF or contracted to do work for NHIF, that does not mean that they now have a moratorium, they cannot expand themselves elsewhere. Because that is their business. It is like telling me that once I roll out universal health care and it's being provided by public facilities, I should stop the development of dispensaries, health centers, and so on, because people might go there and find them not working. That is very poor logic, Mr. Speaker. These things must expand as those which exist provide service. And Mr. Speaker, there's a report here by the Medical Practitioners and Dentist Board examining all these facilities and by their criteria of an outpatient service, like Honorable Shabe said, they exist and they can offer. That doesn't mean that the civil service were compelled to choose all these facilities. The civil service were told, here are the facilities on the website, here are the facilities published in the papers, choose where you want, let us know, and we shall accredit you there. And exactly that was happening. Mr. Speaker, I know that during the first 2 weeks, there were problems. But after 2 weeks, the problem were rectified, and if there were irregularities, they were indeed corrected. Mr. Speaker, I table that report. Finally, Mr. Speaker, the Honorable Eseli in seconding the motion or the report, and the Honorable Speaker, or the Chairman, in tabling the report, said that they have made recommendations. But, Mr. Speaker, we ourselves in the ministry initiated a management audit of NHIF by the IFC and Deloitte. IFC and Deloitte read carefully the report by Alexander Forbes. And IFC and Deloitte came up with very far-reaching recommendations for us on what we should do to roll out universal health care. Those recommendations are much more comprehensive and professional than the recommendations contained in this report. Why should this House adopt these recommendations and not take these which are now table, which will be much more useful to this House and the government than this report? So, Mr. Speaker, this is something that was done professionally or